Hello, I'm Dr. Dennis McKenna. I'm joined today by Mr. John DePaula. John, it's great to have you here.
Great to be here, Dennis.
Been here before many times.
Yes,
great
sir.
to have you back. John, of course, is our Senior Vice President for Diagnostic and Therapeutic Services. We're going to talk about that in a couple minutes.
Sounds good.
Today is Monday, March 31st, giving you the update from Albany Med. All right, John, welcome back to the chair here today. One of the things that has been in the news quite a bit recently is the 5-year anniversary of COVID. Several of us were involved recently in an interview with a local news station. There's been reflections back because of the 5-year anniversary with the announcement, World Health Organization, about it being a global pandemic. We could spend hours on this topic. In fact, the origin story of these videos, of course, is Fred Venditti and I started doing these videos because of COVID.
Yes.
And then obviously it's continued since then. But looking back, what do you remember most about 5 years ago?
I'll tell you, Dennis, the thing that jumps out at me is just being in incident command for months and really dealing with a whole host of issues and trying to continue to provide care, trying to keep our patients safe, trying to keep our staff safe. I remember, you had me run the logistics team. And so,
Great decision.
Our office was right below, our sort of spur of the moment office was right below where incident command was. And again, the team did a phenomenal job of keeping our staff protected with PPE and other supplies that we needed to have to treat our patients. So unforgettable experience.
No doubt. And again, we will never do it justice in this video today. We could spend hours talking about it. A lot is said when they say COVID changed the world, and a lot changed with COVID, right? But a lot of things did not change. And one of the things that didn't change is Albany Med's indispensable role in this region. In fact, if anything, I think it was highlighted. Our mission, our workforce, the resiliency of them, the courage, the leadership, those things were true then, they're true now, right?
Agreed.
And so when we think about COVID, I certainly remember it with a sense of pride. And obviously for those who were here back then that are still with us now, we thank you for everything you did then. We thank you for everything you do now. 5 years, it went
5
fast.
years. It did go fast.
We should definitely do a more detailed look back at some point. Let's do some congratulations. Let's start with Dr. Ali Paul. Dr. Ali Paul is a neurosurgeon here in our Department of Neurosurgery, a remarkable neurosurgeon. I know, John, you want to say a couple things about her. She is receiving the Capital Region Chamber Woman of Excellence Award, and this is about her career and her achievements in her career, as well as her community service. I think we all know Dr. Paul, just an incredible neurosurgeon. So proud to have her as part of our faculty here, and obviously a well-reserved award. And you were going to say something in particular about her.
Great endovascular neurosurgeon, obviously, and we're proud that she's one of our own here at Albany Medical College. She did her residency here at Albany Medical College and continues to do great things here at the Medical Center and for the college.
Yeah, great role model, great role model. Congratulations, Dr. Paul. Sticking on the theme of the college, we talk about, John, all the time, we have a tripartite mission: clinical care, education, research. That's what makes us an academic medical center. When we think about education, it takes place in the hospital, it takes place in the college. College, what's a big day? Match day.
Yes, it is.
Match day. Fourth-year medical students find out where they're going to train and what they're going to train in the next maybe 3 to 8 or 9 years of their life. Our medical school class did remarkable this year. 123 opened up their envelopes, found out where they were going. Just a big congratulations to them. Congratulations to the faculty in the college who prepared them for that. We like to say that if they've chosen to go and train at other locations, we've set them up for success. And if they've chosen to stay here with us, then obviously we get the benefit of them staying. So it's a win-win. Great day, match day in the college. We congratulate them. And I know that you always enjoy that day as well.
It's an incredible day. I mean, the experience of match day for the students, in addition, seeing them with their families, celebrating the end of medical school and starting a new venture in residency. And I know Dean Boulos was incredibly proud of the success that we had and just happy for the college. Very, very special day.
Certainly congratulations to him and the entire deanery and all the faculty. Now, John, as the Senior Vice President for Diagnostic Therapeutic Services, you have 12 different divisions that report up to you. I have the benefit every month of sitting in on the Albany Medical Center Hospital Affairs Committee. You actually do an update there. You do an update at the hospital board. You give an update on each one of them on a regular basis. So we hear about all those different areas. Allow me to focus in on 3 today. I'd love to talk about all 12. We'll have you back. Let's talk about our RAD Tech program, radiology, and what we're doing with Maria College.
Yeah, this is a really exciting opportunity for us, Dennis. We are working with Maria College to establish a radiology technologist program. In fact, Dr. Lynn Ortel, the president of Maria College, Dr. Ann Jung, one of her key operations leaders, we're here on campus meeting with Dr. Mazakis, myself, other radiology leaders. Melissa Grandjean is our director of radiology services, did a wonderful job showing off the clinical learning environment that we're going to have. We're trying to start this program in the fall of 2025, so coming up in the fall, kind of dovetailing right into Maria College's fall schedule. A couple things we've got to go through. We're hoping to hear any day now. The next key step is for New York State Department of Education to give us approval to proceed. We submitted an application several months ago. We've gotten positive feedback from them, so it looks like it's going to be a go in the next coming weeks. And
well, why are we doing it? We're doing this because we will graduate more rad techs in the area, and with the hope that obviously they'll work within the Albany Med Health System. But regardless of where they work, right, this is a great opportunity to kind of create a much needed addition to the clinical workforce in the area. So congratulations on that.
Thank you, Dennis.
Another area that is in your scope of responsibility is emergency management. We have obviously Scott Heller here. He's been here for probably 25 years, remarkable leader, expert, clinical content expert in emergency management. John, recently we had a tabletop, a Code D drill. Go back and talk a little bit about what happened there.
Sure thing. In partnership with New York State, Scott led the drill, and really Scott Heller is an absolute gem, content expert in emergency management. So we participated in this drill, roughly a patient surge related drill where hospitals throughout the region saw a surge of 30 to 40 patients, and just the different dynamics from a physician care standpoint, nursing care standpoint, all of the areas involved from a diagnostic therapeutic services standpoint, and even issues like crowd control. We talked about some of the students coming here on campus, some of the parents finding out about this incident, coming on campus. Just many different factors that we've got to manage under these circumstances, and it's key that we practice them. And one of the good things that I was hearing from some of the clinicians participating is, hey, this could really happen. I think that's when you know you've hit it out of the park with a drill that's applicable and relevant and have people participating at the highest level. And the key reason we do this, Dennis, is, as you alluded to earlier, the services we provide in the region are vital to the community, and we've got to be ready to go 7 days a week, 365 days a year, and always be able to provide
whether
our
it be
services.
severe weather or whether it be a mass gathering, whatever it is, if there's a surge of patients, we know that Albany Med's going to be involved. That's one of the wonderful things about having one common medical record now, is as we redistribute patients in the health system, we can look at records on all the different campuses. Just really important that we do these drills. Thank you to you and Scott for leading those. And then finally, one of the areas that you most recently had an update at the hospital board level in was physical therapy, occupational therapy. We know that mobility is really important. We know that getting patients moving allows them to recover quicker, get discharged quicker, better for their quality outcomes. An important update from Linda Sprague and the team.
Yeah, we have a wonderful team of physical therapists, occupational therapists. Linda has been a driver of the importance of mobility in our patients in terms of just their general health, reduced length of stay, reduced mortality. So Linda had a couple of her therapists present. Michelle Litz and Megan Valley did a presentation on a scale that we would begin to utilize, post it in all of the patient rooms, and really have an interdisciplinary approach to mobility. So our therapists would actually work with our nurses, our patient care associates, our PCAs, to help train them on lifting patients, positioning patients, to get them up and mobile, and ultimately lead to improved care for them.
It's an important initiative. We certainly appreciate Linda and her team leading that effort. Like I said, it's not just about reducing length of stay. It's also about better outcomes. It's about better, return to normal activities of daily living for the patient. So very important.
Definitely.
9 other departments you have. We'll have you come back. You can talk about pharmacy. You can talk about lab. You can talk about all the different areas.
Happy to do that.
But thank you for that. Let's end on some nursing topics here. First of all, pretty soon we'll have Nurses Week, which is always fun. It coincides with the birthday of Florence Nightingale, as I learned many years ago. One of the really most important events during that week is when we recognize our pillars of nursing, usually a half dozen across all the different areas of the hospital: medical, post-surgical, critical care, women and children's, ED, etc. So please, if you would like to nominate a nurse for Pillars of Nursing, the deadline is closing. It's this Wednesday. It's, today's Monday, so you got 2 more days, 9 a.m. It's online. Anybody, John, can do a nomination. So you don't have to be a nurse. Anyone can nominate. Please do. Let's get those nominations in.
Sounds good.
And let's talk about some recent Daisy Award winners. These are awards obviously given to nurses as recognized by patients who have cared for them. It's remarkable. And we have 3 we want to talk about. In the practice, we have a practice nurse, Kara Young. She's in the Department of General Surgery. What was special or unique about her nomination?
Yeah, interesting about her nomination, she was nominated by a nurse that was a patient of ours,
Wow.
complimenting Kara on her high energy level and her tireless efforts in providing care to her. So
Wonderful.
Great job, Kara.
Wonderful, wonderful. We have Marissa Seneca from Labor and Delivery, and she obviously had a wonderful nomination as well.
She did. Humor, professionalism, and empathy.
Beautiful.
So really the full scale of trying to take care of people and make them better.
And then we have a nurse, Andrea Bosboros from the Center for Cancer and Blood Disorders on D4 East, another remarkable winner of the Daisy Award. What's special about Andrea?
Yeah, first off, I'll just call out, Dennis, to your point about the Pillars of Nursing. She won the award in 2023.
Right.
And I always make it a point to go to that award
That's
ceremony,
amazing.
that celebration. It's great to see our nurses and their families celebrate their success. We love our nurses. And really, for Andrea, she was called out for just working with the patient through all the highs and lows of the patient's experience in being here as an inpatient.
So, support, comfort, knowledge, laughs. She knelt beside me one evening as I was in my mom's room. She explained in depth the ups and downs, highs and lows of the entire process.
Yeah.
So very, very
Thank you,
remarkable. And then we had our Eye Care Award winner, David Ravenna, Inventory Site Coordinator for Receiving and Distribution. And that was a remarkable award. We were there when he received it at CCLM. Whenever these individuals receive these awards, I think everyone, has just a great moment. And he gave a wonderful speech. He talked about the fact that he and his team are responsible for taking all the supplies in at the loading dock.
Yep.
And they understand that what's in that box might be necessary for surgery or treating a child or something that we do. And they take that really seriously. And sometimes the label is off. And they know that what's in that box is really important. And he is like a detective, and he figures it out, and he makes sure it gets delivered. And he talks about how much pride he has in doing that, and I love that.
Yeah, Dennis, I think we've been there, not on many occasions, but on a few occasions where we have a patient waiting for a procedure to be done, and we need to have that piece of equipment or that supply item. And I did. I loved it that he was called out for his detective approach in order to chase down those supply items or equipment items. So thank you.
Thank you, David, and thank you to David's team. So in reflection, JD, thanks for being here. We appreciate you. It's always easy with you here, and you have a wonderful team, so thank you to them as well.
Thank you, Dennis.
We'll be back again in 2 weeks. Obviously, in the meantime, now more than ever, we thank you for what you're doing in order to keep us going forward with our mission. And as always, we ask that you once again, please take care of yourself and take care of each other, and we'll see you in 2 weeks.